Hello everyone, and welcome to another episode of Ask Dr. Bob, and we have some questions that nobody's ever asked before, and here's the very first one. Dr. Bob, what do you think of whey leucine? Well, whey, from my experience, creates distress in a person's body. We don't really promote any kind of dairy product, so whey would come from a dairy source. Now, leucine is an amino acid. You have anywhere from 20 to 22 different amino acids. You have 8 or 9 essential amino acids. It all depends on who you read. You want to consume a variety of proteins. In our practice, we use a pea protein, and we also use a pumpkin protein. I'd encourage you to use kale. I would try other sources besides whey. I would not use soy. No soy. Soy will create distress. Number 2, Dr. Bob. This is very interesting. My white blood cell count is 3.6. The normal range is from 3.8 to 10.8. I keep a healthy lifestyle, etc. Want us to know what to do, and happen to be a female. There's something that we have discovered over time called the working woman syndrome. Low white blood count, high lymph count, lymphocytes. It's just a pattern that we're seeing, compromised immune system. Oftentimes we have these working ladies, they have 14 plates going up in the air and the white blood count is down. For sure you want to minimize or eliminate sugar. Now, in our practice we use a product called cytozyme thighs, a thymus tissue to help improve your immune system. I may encourage you to have your blood pressure taken from a sit to a stand position. And if your blood pressure drops, I know you have adrenal fatigue, I also would encourage you to use protein. You want your globulin level checked. It should be 2.7. If it's less than 2.7, you're not eating enough protein. If it's above 2.7, you're eating the protein, but it's not being absorbed. Now, if you don't see the globulin on your typical blood test, subtract the albumin from total protein. That'll give you your globulin level. Somebody asked, how about hair dye? What dyes are safe? Well, when I really did more investigating in this, even henna. Now, I have anything against any hair products, but what's going on today is that there are chemicals, there are potential toxins, basically in every type of dye. Henna has something called lawsone, Lawsone. So I would be aware of everything you're putting in and on your body. If you make the choice to color your hair, I'm telling you not to color your hair, but I would put the least amount of other toxins on your body. I've noticed more and more ladies say that are going natural, they have gray hair. It just depends what you feel good with. I'm not going to be able to give you a direct answer about what product is safe. This question was henna, and you can do a search on it yourself. Last question, Dr. Bob. I suffer with headaches day and night. Please, what to do? Well, first you want to find a skilled chiropractor. I may encourage you to come to our office. We're in Cleveland. We see people from all over the United States. If you have a morning headache, it's usually a blood sugar headache. If you have a headache that changes with the barometric pressure, it could be lack of B vitamins. If you have a hormonal headache that's right before or right after your menses, depending if your breasts are tender or not, it could be another headache. But if you have a constant headache, you want someone to check your neck. In our practice, we have very innovative technology. We can literally take a video spinal fluoroscopy of you. We have unprecedented results with the type of technology. Great question. It's okay to pursue this. Try to find someone that can put their hands on your body. I may encourage you to have some blood tests done too. Also have your thyroid checked. Stay away from fruit. My name is Dr. Bob DiMaria, the Drugless Doctor.